Hello, and welcome to Safe and Sound with CCOHS. According to Health Canada, almost 8 million Canadians live with chronic pain, defined as pain experienced on most days or every day for 3 months or more. Our guest today is Dr. Andrea Furlan, a physician scientist and professor in the Department of Medicine at the University of Toronto, whose research focuses on the management of chronic pain. Dr. Furlan also happens to have a popular YouTube channel with many helpful videos on the topic. Dr. Furlan, thanks for joining us today.
Thank you for inviting me to talk to you today.
My pleasure. Let's start off with some common misunderstandings workplaces might have about chronic pain. Can you list some of those for us?
Yes, there are many misunderstandings because chronic pain is not the same thing as acute pain. And a lot of people, including healthcare professionals, don't understand the difference. Acute pain is that pain that we all know when we have like a toothache, an inflamed appendicitis, or an inflamed joint,
Right.
or a fracture. But chronic pain is different. And you do need to understand that chronic pain doesn't show up on MRIs of the knee, even though, let's say, the knee, the hip, the hand, the neck hurts, but there is no imaging, blood test, electrodiagnosis, because the problem is the pain now became centralized. It's a
Okay.
problem of the central nervous system. The brain became changed. It's almost like a memory that keeps ringing. I usually explain to the patient that it's that alarm system of the house that was supposed to go off and make a lot of noise if there's a fire in the kitchen. But now imagine that 5 years later, the fire is not there anymore, but the alarm continues going on and on and on. This means that the alarm is broken. It doesn't mean that there's a fire in the kitchen. So this is chronic pain. Another misunderstanding also is that if people is using opioids for chronic pain is because they are addicted.
Right.
Also, if a person has chronic pain, they're not getting better with all the treatments because they are weak, mentally incapable, they have a low tolerance to pain, or just lazy. Those are all the common misunderstandings that I see, not only in workplaces, but also in healthcare.
Right. So lots of being affected by stigma as well, it sounds like.
Yes.
What are you hearing most often from your patients about how chronic pain affects their jobs?
Yeah, first of all, my patients tell me they want to work. Very rarely they say, I don't want to work. I just, and use the chronic pain as a crutch to not to go to work. Most of them love what they do. They invested time. They have a profession. They have, that's their identity. Some people,
Right.
working, their profession is how they identify themselves. Like if you ask someone, who are you? The first thing they will say is their profession. And the moment that they don't
What do
work
you do?
anymore,
Yeah.
yeah, right. So they say, I'm a physician. Now, if I can't work as a physician anymore, who am I? So for them, they lose their identity. So first of all, they do want to work, but they tell me, they have because chronic pain is a centralized disease that affects the brains, mainly a disease of the brain, the central nervous system, the immunological system. So the brain is almost in hypervigilance all the time. It's where's the danger? Imagine the brain is feeling pain. The pain is real. It's
Yes.
not the
Yeah.
brain's fabricating. For the brain, there's no difference. Like the alarm system of the house is making the same noise if there's a fire in the kitchen or if the alarm is broken. So pain is pain. Doesn't matter if the knee is broken or if it's the memory of that pain in the brain. So they say, I can't sleep at night. I have insomnia at night, and then I have fatigue during the day. And because of this, I have this brain fog. I have poor concentration. How can I, my job, I need to think, I need to make decisions. And then they also tell me that they lose patience with their coworkers. They lose the empathy. Imagine someone who has to work with customers, coworkers, bosses, and a team, and they don't have empathy. Also, they tell me it's hard for them to commute, drive, or take public transportation. And they also tell me that during the day, sometimes they don't have even time to have a lunch or to take breaks, to do exercises, to relax, to meditate, because meditation, relaxation, going for a walk helps this brain sensitization to reset.
Right.
But they say, I don't have, enough breaks that I can do that. So then the option they have is to take days off or even go on disability.
How can employers be supporting their workers experiencing chronic pain? What can they do?
This is so important from managers, co-workers, from supervisors. First, acknowledge that the pain is real. I have heard this thousands of times that they say people don't believe me. I wish I had a cancer because people would be more empathetic
Oh,
towards me.
wow.
I wish I had an amputation because then people could see that I was suffering. Because pain is an invisible disability that they have to fake. They are doing well. Most of the patients that I have, they say, I fake all the time. People ask me, how are you? And I have to say, I'm okay, but I'm hurting. And imagine fibromyalgia. Fibromyalgia affects up to 5% of the general population, more women than men. And it's a pain that affects the whole body all the time. And they have to fake. So that's the first thing, acknowledging that the pain is real, that they are in pain. They are not, inventing this. It's not psychological, emotional pain. And then
Right.
offer accommodations, offer work modifications, encourage them to, talk to their doctors and nurse practitioners, their physiotherapists, psychologists, because sometimes they even are afraid of mentioning this to their doctors, and the doctors say, oh, it's because you're getting old, or it's impossible for your whole body to be hurting. Fibromyalgia doesn't exist.
Right.
Unfortunately, there are a lot of still healthcare professionals that don't believe the neuroscience of chronic pain has advanced so much in the last 20, 30 years. Even I can't keep up with all the science, how advanced it
Is
is.
that right?
Yes, but it's mainly chronic pain is a disease of the nervous system. Even there are now some research studies showing the changes in the brain stem, spinal cord, immunological, even the microbiome in the guts are changed because of chronic pain. So it's a biological disease, and so acknowledging that there is treatment, informing the workers about what they have as a benefits for them. Do you know that you can use psychology sessions? Did you know that you have the, 10, 12, 30 sessions of massage per year?
Mm-hmm.
You know that you can get a discount on a gym membership. Did you know that you can take some sick days? Informing them about what they can have in terms of their benefits would go a long way.
Those are some great ideas. And even just as simple as making space to, take a break, take a walk, have some time
Yeah.
to meditate. What steps can workers experiencing chronic pain take to advocate for themselves?
Yeah, so as I said, most people with chronic pain, first of all, they are afraid of disclosing and how they will be seen. And I see some people that try to be stoic, strong, I'm resilient, I have a very high pain tolerance,
It's only pain.
it's only pain. Yeah, and then they don't talk, they don't disclose. So steps first, talk about it. And because chronic pain affects 20% of the adult population in Canada, so it's
A
one in
huge part.
five. Maybe you have other coworkers that are in the same boat as you are, and you don't know, you're all hiding.
Mm-hmm.
And maybe you can form like a group. You can, help each other. You can study more about the modern neuroscience of pain mechanisms, bring someone to talk to you, explore non-traditional treatments for your pain, like mind-body therapies, self-management, movement, acupuncture, yoga, aquatherapy, exposure to nature. There's
Mm-hmm.
evidence that exposure to nature helps because, again, if you think about the brain is in the overdrive, hypervigilant, and thinking that there is a danger, a fire in the kitchen somewhere, anything that you do to calm down, put your brain at safe. You know what? The doctor told me that my knee is good. The doctor examined my knee and told me, your knee is strong. The range of motion is perfect. You can do anything you want. So you can do anything you want. And the pain is just a signal that remained in your pain system. So basically, overcoming those fears of pain. And also, another thing that I like to tell
Mm.
people have a tendency to equate pain is equal to a structural problem and I need a pill.
Yeah.
That The first one is probably not true. If you have acute pain, probably you have a structural problem. But if you have chronic pain, probably the structural problem is healed already,
Hmm.
and all you have is this centralization. And medications are not good for chronic pain. They're excellent. Like opioids are great for acute pain.
Right.
When there's a structural inflammation, they're not for chronic pain that much. So become less resilient on medications, because you don't want to be using those for the rest of your life. So
Right.
find another non-pharmacological, non-drug prescriptions. Talk to your doctor. Don't stop your medications abruptly. Talk to your doctor. Say, I'd like to rely less on these pills. Can you help me to find other things? Try them, because in the long term, the more natural, non-drug options are much better, healthier, and safer.
That's important to know. And when workers are returning from an injury, let's say, what makes the difference between an effective return to work plan and one that unintentionally makes things worse for someone who's suffering chronic pain?
Yes, yeah, reaching that balance is really hard, right? You don't want to go too soon and in an acute pain phase, right?
Hmm.
Because again, we might be in that transition from acute to chronic. So if you still have an acute injury, like a tendinitis, that the tendons are inflamed, or you had surgery to repair the tendon, the shoulder, the knee, the hip, you do need to give time for them to heal.
Right.
Now, if they have chronic pain and those injuries, damages, those conditions are not there anymore, the sooner the better. For chronic pain, the sooner you get out of your house and into a place that you can distract your brain with other things, it's excellent. I tell my patients with chronic pain, think about work as therapy for your brain, because we do need to occupy the brain with other things that are not pain. Because if you spend your day at home, guess what? You have more time to think about the pain. And the more you
Yes.
think, the stronger those memories, those synapses. This is neuroplasticity. The more
Hmm.
you practice, let's say I play piano, the more I practice piano, the better I play.
Makes sense.
Right? So then, because why? Because I'm training those synapses. Now,
Hmm.
the more you feel that pain, I'm talking about the chronic pain now. The more
Yes.
you practice that chronic pain, the more you think about it, the more you worried about it, you're practicing those synapses. They're getting very professional.
Hmm.
So work is a way that you can undo those synapses. You can unlearn those synapses because you are occupying your brain with something else. Another thing that I also like to mention in the return to work is a lot of people with chronic pain, even the patients themselves, they don't pay attention to the mental health. They
Mm.
only focus on the physical health. So both, we can't separate our mind from our body. When we start therapy, interventions, treatments for chronic pain, we always have to combine mind, body, and physical treatments because, as I mentioned, the chronic pain is a different disease and
Hmm.
it does involve the emotions. And if we don't tackle those emotions, we will not be able to obtain the best results, even of the physical modalities. Like if you go to physiotherapy and you're only doing exercise for your body, that's one thing. But when you work with a mental health provider and you lose the fear of movement, which is very common with chronic pain, the
Mm.
fear of movement paralyzes. The fear of the pain is more disabling than the pain itself. So when you tackle those mental health aspects, then your recovery is much faster.
That's fascinating. And I know we're just scratching the surface here on a topic that obviously we could talk about for a really long time. What else would you like our audience to know about chronic pain and your work?
Yeah, there's so much. I wish I had, many, many hours here with you, but I know we are short of time. So if people want to learn more about chronic pain, there are so many resources, excellent resources nowadays on the internet. I put a lot of videos on YouTube, as you mentioned in the beginning, because
That's
I
right.
want I also don't have a lot of time with my own patients in the clinic here at UHN. So I wish I tell them, I wish I had 2 hours to give you a lot of knowledge and explanations, but I don't. So go home and watch my videos on YouTube. I have more than 200 long videos that I talk about a lot of I even demonstrate some exercise. I talk about diet. I talk about sleep, constipation. I talk about the whole body, the whole person. And
Hmm.
then I published 2 books, basically the same material that I put on my YouTube channel, I put in books because some people prefer to read and they are better readers than watchers. And so I
Right.
have flavors for everybody. If you like to watch me talking, watch me on YouTube. If you like to read, then I have books for people about chronic pain.
Amazing. Well, yeah, clearly the content is resonating with people. So you've amassed quite an audience. Amazing. Well, thank you so much, Dr. Furlan, for taking the time to be here with us today. We appreciate your expertise. And as Dr. Furlan mentioned, you can look for more information on her YouTube channel or to check out her books. You can also find a library of information on many workplace health and safety topics at our website, ccohs.ca. Thanks for listening and stay safe out there.